Sorry I missed your call. It took too long to answer. The reason was I was just dancing to the ringtone that was so attractive and made me forced to dance. Now, coming to the restless leg syndrome, the types, there are two types. One is primary RLS and the other is secondary RLS. First, the primary RLS, it is considered idiopathic as the no known cause is known. It is more prevalent, found in the younger patients and felt to be familiar. It begins slowly before 40 to 45 years of age and disappear from disappear for a long time, months or years, and then recur again. It may be progressive and gets worse with the age. RLS in children is often misdiagnosed as the growing pain. The other type is the secondary RLS. It has got a sudden onset after the age of 40 and it occurs daily, mostly associated with some specific medical condition or the use of certain drugs. It is mostly due to the iron deficiency and seen in pregnancy, renal failure, poor gut iron absorption in after the surgery, and distressing symptoms are at least twice a week seen in 2.5 2.7% of the population. Now, what is the disease mechanism? Most research on the disease mechanism of the restless leg syndrome has focused on the dopamine and the iron system. These hypotheses are based on observation that iron and the levodopa, a prodrug of the dopamine, are responsible that can cross the blood-brain barrier and is metabolized in the brain into the dopamine, that is the levodopa and dopaminergic products, as well as the other monoamine neurotransmitters of catecholamine class are responsible. It can be used to treat the restless leg syndrome. Now, the disease mechanism, if you just try to understand, here it is the dorsal horn and here it is the dorsal root ganglion, and from here one can have the afferent sensory neurons which give sensation to that, and from the ventral horn this is what the efferent, the motor neuron do appear, and that is the sensory and that is the motor part, and here is the gray matter and the ventral root that is rising from the ventral horn, and these are mostly the motor fibers. Descending dopamine projection fibers, and these are the here there is the high D3 receptor and the low D1 receptor, that is the pink area as one can see, and here there is the high D1 receptor and the low D3 receptor, that is the green area. So the pink area is having high D3 receptor and this green area contains high D1 receptor. Now, understanding disease mechanism, transmission of the information is, and here one can see the nerve cell and the dopamine. The dopamine is released from the nerve cells, and here there is another nerve cell which is having the dopamine receptor. And here one can see the dopamine which is being released by this nerve cell. that is being taken up by the receptor, which are called dopamine receptor, and this is just going to transmit the information. These receptors take the dopamine, and then transmission of the information occurs in this nerve cell. Now, disease mechanism, levodopa being a medicine for treating hypodopaminergic low dopamine condition such as Parkinsonism or Parkinson's disease, proved on finding from the functional brain imaging, that is positron emission tomography and functional magnetic resonance imaging, autopsy series, and animal experiments. The differences in the dopamine and iron related markers have been seen in cerebrospinal fluid also. There is low iron level in the substantia nigra of the RLS patient. So now, how to diagnose the RLS? Number one is the history. 4 symptoms are used to confirm the diagnosis. These symptoms are just set by NIH criteria, National Institute of Health. Number one, a strong urge to move limbs with or without sensation. Number two, worsening at rest of the symptom. Number three, improvement with activity. And number four is worsening in the evening or at night. So these are the 4 symptoms which are used for diagnosing that. And here one can just see that the patients often describe an unpleasant crawling or creeping, that is sensation in the feet, calves, and the thigh muscles. Occasionally the arms can be affected. So here one can see that is number one. Number two is the symptoms are worse in the evening or at night, as one can see from the sunrise. Number three, the symptoms are relieved by moving the legs, as one can see. The movement of leg gives relief to the symptom. And number four, the symptoms are worse at night, that is seen as number four, the symptom. Now, the diagnosis, there is no specific test for RLS, but non-specific laboratory tests are used to rule out the vitamin deficiencies. Only 20% of the patients of restless leg syndrome are accurately diagnosed. Diagnosis is more difficult in children and cognitively impaired elderly patients who cannot tell the real feeling and the symptom. Secondary causes of the RLS can be detected. Iron studies for the iron deficiency, ferritin, and iron saturation levels are very important. Renal study for end-stage renal disease, and the pregnancy test only if possible missed pregnancy. Then the differential diagnosis of RLS are Parkinson's disease, fibromyalgia, muscle disease, joint conditions like arthritis and back pain, nerve problems like peripheral neuropathy caused by the diabetes, which is called diabetic neuropathy, and neuropathic pain syndrome, and the circulation difficulties in the legs are also the differential diagnosis. In children, restless leg syndrome is often misdiagnosed as the growing pains which occurs in the children. Nocturnal leg cramps, restless insomnia, drug-induced akathisia, comorbidities, depression and depressed mood, hypertension sometimes, and anxiety sometimes are also. Here one can see the beauty of the God made things. That is a strawberry that looks like to be thumb up and the fingers just to make a appearance of a hand like this. This is the God creativity. Now, what is the treatment of RLS? Reduce symptoms treatment, just reduce symptom, decreasing the daytime somnolence and improving the quality of sleep are the aims of the treatment. Treat first any underlying illness if known, that is in case of the secondary RLS. Blood test to see underlying iron deficiency anemia, oral iron supplement to increase ferritin levels to reach 80 microgram per liter. If varicose veins, then surgery to repair the circulation. Avoid RLS precipitants like medications, reduction or elimination of the caffeine, nicotine, alcohol from the diet, which are responsible for precipitating the disease. Stop smoking will diminish or the prevent smoke symptom. Secondary RLS, if the precipitating medical condition like anemia, venous disorder, and the thyroid, these are treatable problem, so treat them. So here the treatment of RLS mainly iron supplement if the ferritin level is less than 75, make it rise above the 80 microgram per liter. That in chronic RLS, dopamine agonist or gabapentin is given. Intermittent problem, carbidopa, levodopa, low potency opioids, benzodiazepine, and zolpidem is the treatment of choice. And the non-pharmacological sleep hygiene, avoid ETOH, caffeine, and the moderate exercise will also help to relieve the symptom. Now, regarding the medical treatment, medication from the 5 categories are being used. Number 1, the dopamine agonist like ropinirole, pramipexole, carbidopa-levodopa combination or pergolide. Then rotigotine is delivered by transdermal patch. Main issue with the dopamine agonist is they cause augmentation. Drug itself causes increase in the symptoms and the rebound sometime, and that is also causing the compulsive gambling. Other number 2 group is gabapentin and carbil. It is a non-dopaminergic treatment. Now, number 3 are the opioids, particularly methadone, do not have negative side effects like augmentation and rebounding, and of dopamine agonist, codeine, propoxyphene, tramadol, hydrocodone, and oxycodone can be used as a part of the opioids. Then benzodiazepine, number 4 group, sedative hypnotics like diazepam, clonazepam, triazolam, and temazepam are used. It gives symptom relief and just help in staying asleep. Then number 5 group is anticonvulsants. These are just the carbamazepine used for the epilepsy. The treatment continuing, get better sleep and exercise, SSRIs and the tricyclic antidepressant, baclofen, bromkripine, and clonidine sometime. RLS drug therapy is not curative and has side effects like nausea, dizziness, hallucination, orthostatic hypertension, or daytime sleep attacks. Other drugs like cannabis eliminates the nausea caused from the medication and relief pain. Then medical marijuana as alcohol. Quinine is frequently used, but it has serious hematological side effects, so considered but given very cautiously. Vitamin C and vitamin E and their combination are also helpful, found to be effective, and these are also safe. Then the alternate treatment which are being used, these are warm and the cold baths, electric nerve stimulation, oral magnesium, natural treatments such as quinine water at bedtime, tonic water, said to be anxiety may trigger or increase RLS symptom. Many items like lavender soap, fumes, or acupuncture may reduce anxiety and reduce the symptom of restless leg syndrome. Many home remedies and the herbs have some role also. So, apple cider vinegar and hot and cold foot socks, Epsom salt, and these are all the home remedies for the restless leg syndrome. One can use that if one just want to have some help from the home remedies. Then also certain things like exercise and consider the supplements and get a nighttime routine properly, cryotherapy and other these plants as one can see these are also helpful to some extent olive leaf, lemon and these are all the herbs which are being considered helpful for the restless leg syndrome. Now, the prevention is only preventing the underlying causes. It's that is known only on secondary type of RLS. So that is the end of the lecture of restless leg syndrome. I tried my best to give the comprehensive account of this topic, and I hope if you like it, please subscribe my channel and share it with others. And if any question, you can ask me. And thank you very much to be with me and giving time to this. Thank you.